Inadequate expectations, infection of the graft canals, necrosis of part of the follicular units. What are the causes of cobblestoning? Blunt punches are also used, not cutting, but pushing the tissue apart and get rid of the problem. About stem cells, it's a reduction in the density of hair growth in the donor area. Barocamera.
Yeah, cobblestoning.
This can cause necrosis. You can remove it with very fine sandpaper. The surgeon has to get the grafts into the grafting area correctly. Please don't forget to subscribe to the channel and share the video. If you have any questions, you can ask directly in the comments under the video. Within the first hour after the video is released, I actively answer all questions that come in the comments. The most popular problems after a hair transplant. Let's categorize them into planned and unplanned problems. Today, we are going to talk about unplanned problems that we would like to avoid by anyways. The first is insufficient density of hair growth in the transplant area. Here, of course, very much depends on the qualifications of the doctor and the clinic in which you do the operation, and also elementary from the blood supply which will be available to the hair at this or that density of transplantation. It is not always possible to transplant a huge number of grafts in 10,000 grafts, for example, and all 10,000 grafts will take root. They will take root under the conditions that will allow the hair to survive. That is, it must necessarily be feeding and the quality of the follicle itself, and necessarily blood supply. For example, if we take 10,000 grafts and transplant them to a very small area, they will simply not have enough blood supply. You're just going to lose that huge amount of grafts. You'd also lose your precious donor stock. Those grafts that have enough nutrition will take root. Don't forget the care and rehabilitation after hair transplantation will also play a huge role, as well as genetics and even age. The second is necrosis of a portion of the follicular units. Necrosis can occur with poor quality grafts. If, for example, the grafts that were transplanted were not properly prepared or kept also improperly, which is often the case in what I call fast food clinics. I've seen it myself. And even at conferences, doctors even discuss at what temperature and in what solutions the grafts should be properly stored to maximize their survival. What about clinics where the assistants are just practicing? Surgery cannot cost less than $2,000. Remember that. The next cause of necrosis could be insufficient blood supply. The surgeon must properly insert the grafts into the grafting area and ensure adequate blood supply. Without the necessary blood supply and feeding, grafts elementary will not take root. Also, necrosis can be caused by infections. It is important to observe antiseptic measures during and after the procedure of hair transplantation. Next, trauma or pressure. Excessive mechanical impact on the transplanted grafts, such as strong friction, pressure, or trauma, can lead to their damage and necrosis. Be careful, especially the first week after hair transplantation. Why I always tell you, make sure you take care of your head after the hair transplant. Getting in the car, be sure to look where the ceiling, so that you don't touch the transplanted area of the ceiling, or in an airplane, for example. Take care of your head. Remember that this will determine the survivability and effectiveness. Do not forget about the individual reaction of the organism. Sometimes the body may not accept some grafts, and this can cause necrosis. Therefore, it is important to choose an experienced and qualified surgeon to prevent graft necrosis and ensure better engraftment. Follow the post-transplant care recommendations and monitor your health during the recovery period. If any complications or symptoms of necrosis occur, it is important to see a medical professional in a timely manner for evaluation and treatment. The first thing you should do is to inform the clinic where you had your hair transplant that you have a problem. And then you should proceed from the recommendation of the doctor who knows your head and has worked specifically with your head. He can recommend something. What to do if you have been to an unqualified doctor and you suspect that you may have necrosis. Actually, I decided to record this video after I was consulted a person who had already had a hair transplant. Of course, it was done in a sloppy manner and with the risk of necrosis. What to do if your doctor is not a doctor at all, or he just doesn't know what to do. When I was at the first hair transplant forum in Bangkok, doctors shared and discussed necrosis and shared what can be used in some cases. Unfortunately, I can't talk about it on YouTube due to YouTube rules, but I easily share it in my consultations. These include medications that improve microcirculation in the transplant area. The third point is plasmolifting, the introduction of platelet-rich autoplasm to accelerate tissue healing. But remember that if you have already injected PRP, it makes no sense to re-inject and make PRP again. It is very important that you do not PPP, but PRP. If someone hasn't watched the video about it, make sure you watch it. The next thing that can help is oxygen cocktails and ozone therapy to saturate the transplant area with oxygen. A Barocamera is also used for the same purpose. Massage of the transplant area on the 6th to 8th day to improve lymph and blood circulation. So, as you can see, everything is aimed at increasing blood circulation. Barocamera. The use of a Barocamera has to do with creating high pressure and providing the body with lots of pressurized oxygen. This can help promote healing and tissue regeneration, since the increased pressure can increase the solubility of oxygen in the blood and speed up its delivery to damaged tissues, which helps in their recovery. However, the use of a Barocamera is a medical procedure and requires a doctor's prescription. So once again, it is very important that it is your doctor who performs your transplant, not the person who printed himself a diploma or called himself a doctor, but a real doctor with a medical degree. The next point is to follow a gentle regime. Avoid physical activity, trauma, and stress. Hyaluronic acid is also used topically for moisturization and regeneration. Hyaluron gel can be for external use. Usually the concentration of hyaluronic acid in such gels is 0.02 to 1%, and the gel is applied in a thin layer to the hair transplant area. There are also hyaluronic dressings. These contain sodium gyaluronate, which is actually prolonged release onto the skin. Proper mesotherapy with vitamin and amino acid complexes can also help. Taking B vitamins, ascorbic acid, and amino acids for general metabolic improvement will also be helpful. The main goal here is what? Maximize nutrition and blood supply to the follicles to restore engrafted hair and prevent necrosis. Almost all possible questions are already covered in my videos on my main Russian language channel, videos from which I am gradually translating into English. If you don't have time to watch videos, book an individual one-on-one consultation where I will personally analyze your situation and create a plan of action specifically for you. Every case is different, so we will make a plan that will work exactly for you. Plus, a clinic promo code will even make your transplant cheaper. The next unplanned and unexpected problem that may arise is infection of the graft canal. In my experience, I have not had such cases yet, but they also sometimes happen in cheap clinics where, unfortunately, inexperienced doctors do not know how to perform the surgery properly and what to do in case of problems. Nevertheless, these are still rare cases, which can happen for the following reasons. First, failure to observe sterility. Here you should choose a good clinic with an experienced doctor. About this, I repeat myself constantly. Violation of hygiene rules after surgery and improper care can also contribute to infection. Weakened immune system. If a patient has a weakened immune system, they may be more susceptible to infection. Environment. Because of this, it is very important, especially in the first few days, to be careful. You don't have to stay at home for the first week, but just be careful. Do not walk in the rain, in strong winds, which, for example, scatter dust and trash in the area. Just be careful and think twice before doing something. Within the first hour after the video is released, I actively answer all questions that come in the comments. Allergic reactions to the medications used in hair transplants also happen. Don't expect to be quizzed on every possible allergy. If you know anything about the specifics of your body, make sure you tell the doctor before your hair transplant. Another problem that turns out to happen is a decrease in the density of hair growth in the donor area. What could be the causes? Trauma to the hair follicles during graft extraction, tissue fibrosis and scarring occurs. Further, disruption of blood supply to follicles due to damaged vessels, inflammatory reactions, and infection of follicles. The formation of scars in the donor area, which squeeze the follicles. And all this appears as a decrease in the amount of growing hair on the donor area. What is recommended in this case? The first is the use of thin punches for less damage to the skin. Blunt punches are also used. Not cutting but pushing the tissue apart. It is recommended to take the grafts at an acute angle to the skin surface, not perpendicularly. When taking grafts perpendicularly, there is a very high chance of damaging the vessels and actually causing problems. Also, according to my observations in good clinics after transplantation, use special healing ointments that allow you to heal as quickly as possible those areas from which your grafts were taken. If there is still a problem, what is usually done in this case? The first is plasmolifting with PRP to stimulate hair growth. The second is mesotherapy with micronutrients and vitamins. Laser hair growth stimulation is also used. The use of medications to stimulate the follicles is also recommended. Let's not forget about stem cells and cell technologies, which are now used for this purpose as well. If any of you have experienced one of these problems or maybe some other problems, please share in the comments so I know what someone is having and can ask doctors about these or those problems, what they do in certain cases. Approach hair transplants as an investment. There's an international forum again in a few weeks, so if I get any questions from you, I can also ask them to famous doctors from all over the world to find solutions to certain problems that you may encounter. If you don't do a transplant well, you'll spend the rest of your life wondering how to fix it. And the donor stock isn't unlimited. It is very important to analyze the situation completely. What do you have? What age? What diseases? What dynamics of hair loss? What donor area? And so on. We always consider all this in my detailed consultation one-to-one. We then make a plan based on all of these factors. The third point is the modeling of the front line. The front line is very important in a hair transplant. It's something you have to live with for the rest of your life, and your appearance will depend on it. For some, it doesn't matter, but until you regret not thinking about it earlier. The next thing is choosing the right clinic and the right doctor for your specific case. Because clinics are different from each other, just like doctors can be different from each other in their specifics. Some doctors are very good at covering large and huge areas of baldness. Some doctors emphasize the front line specifically and create those unique front lines that are indistinguishable from heads that have never undergone a hair transplant. Some doctors are great at increasing hair density in areas where you have sparse hair. For each individual case, you need to choose the right clinic and the right doctor who will properly implement our plan, and you'll get your unique result. One quite popular problem after hair transplant is cobblestoning. These are the bumps and thickening of the skin that sometimes occur after a hair transplant. You know, like bumpy spots. And if you shave your head bald, your scalp will look like cobblestone with like blisters. I first encountered this problem 3 years ago. A guy who had surgery with Dr. Burjan wrote to me. He had been suffering with this problem for quite some time. I became interested in it and asked doctors on forums, and they suggested some points that I was surprised at first. In general, what are the causes of cobblestoning? Why do they occur? The first is scarring of the skin due to tissue trauma during FUE. The second is inflammatory reactions and swelling leading to fibrosis. The third is dense keloid scarring at the graft exit sites. Well, and also improper care in the post-operative period. How does it all show up? It's an uneven, bumpy skin surface in the area of the hair transplant. Sometimes you can see it right after the hair transplant, like in this video right here.
Do you know Cobblestoning? Cobblestoning.
Yes.
You get these tight nodules, like peas on the scalp. It's also sometimes accompanied by itching and discomfort. Sometimes just a timely massage to soften the scars and prevent fibrosis can help. But this has to be done early enough. Sometimes hyaluronidase steroids are used for resorption. Sometimes they use laser skin resurfacing, shall we say. And what the doctors themselves recommended to me is peels and dermobrasion, if I'm calling it right. I mean, peeling can be done at home, but dermobrasion is done with special tools such as rotating circles and crystal microdermabrasion, or lasers. Dermobrasion can be done in medical offices or cosmetic centers by professionals with certain experience. The procedure can be a bit painful and usually requires time for the skin to heal and recover from the procedure. So essentially the surface layer of skin is removed along with these bumps. This procedure can help to improve the texture of the skin, make it smoother, and get rid of this problem. It is important to note that dermobrasion is a procedure that requires specialist training and may have risks and limitations. And also, as one doctor from Iran told me, you can do it yourself with very fine sandpaper. Just sand in these areas right here. Just be super careful. I thought it was a joke at first, but I asked again and he said, yes, you can do it.
Doctor, I'm sorry, how to remove...
Cobblestoning?
Yeah, cobblestoning.
Cobblestoning is this.
Yeah. Is it any way to remove that?
Yeah, by sandpaper. Very easy.
No, seriously.
Yeah, seriously. It's scientific.
How?
Sandpaper, do you know sandpaper?
Yeah.
For nail, for wood.
Seriously?
Yeah.
No way.
You can search in book and textbook.
Really?
Huh?
Just one time and it was...
One or two times, it depends your expertise and how you respect to tissue.
And how strong to...
But gentle.
Just a few times it will be enough.
2 times every week, 1 time.
Every week.
Every week, 1 time. Gentle.
Wow.
And of course, I didn't talk about those problems like inadequate expectations. Someone always says, I want density like when I was a kid. I don't see that as a problem. It's more of a lack of knowledge and lack of information and learning about the topic before some people do hair transplants. Educate yourself. A hair transplant is not just some procedure on a bet. It is something that can change your life, and only you alone can determine those changes, for better or for worse. As much as you properly prepare for the surgery and approach it prepared so effectively, you'll get the results we're going for. The shortest way to hair and self-confidence with VALYN